All right. Emily, are we ready?
I'm just loading. 1 second, please. Thank you, Jameson. We're ready.
All right. Well, good morning, everyone. Thank you for attending our Tuesday, January 12th investor meeting. As always, we've got a packed agenda. We're going to try and be done around 9 o'clock. Obviously, lots and lots going on in the world and in our community. And we're going to touch on a whole lot of items that hopefully give some updates on some of those. As for the Alliance, really probably the hottest topic at this point. The last couple of weeks, we've really been finalizing the budget for 2021. And as you all can imagine, in trying to finalize that budget, we're trying to kind of build in the ability for us to pivot away from some of the strategic initiatives, depending on what all happens with the pandemic and when things reopen and when we've got an opportunity to kind of stretch our legs a little bit and reach out further. So that's an interesting piece to have in budget conversations. The other piece is the annual report. We will get that out in the coming weeks just to kind of recap 2020. Working on review templates, obviously, for the staff of the Alliance have done an outstanding job. And that's really the board update. At this point, I will hand it over to our Executive Director, Michael French, for his update.
Good morning. Thank you, Jameson. As Jameson stated, our annual report will be published by January 29th, and we'll review that in the February 9th meeting, investor meeting. We should have the budget published by the investor meeting as well. We're just waiting for the board to pass the latest version of it. There's a kind of two versions of the budget, one with a economic development summit and one without, or a hybrid model depending on how the year goes. And we're still very focused on recovery efforts right now. There's the state 20B recovery grant that is out. That application is live as of yesterday. We'll go ahead and publish that today to our members with all the information on how to apply for that. PPP round 2 is out as well. Mary Shepard from SBDC will cover that today in detail. And I think there's a couple of webinars already scheduled, one for SBDC and the Chamber is planning to do something as well with Mary. We have Jack Llewellyn and Dave Woodruff here with us today to talk about the 5-star certification program and its status. And as we've talked about historically, the strategic plan is on the table. We're still looking for input, and we will publish this as well on the 29th of January to our broader membership. So with that being said, we do have a very big agenda. I think we're going to run a little over time just because of the content that we have. So please be patient. If we go 10 minutes past the hour, that's probably going to be expected. Jameson, do you want to introduce our speakers?
You bet. Thanks, Mike. Our first presentation will be from Brian Devine. He's the environmental health director with San Juan Basin Health. Brian, if you could give us an update, we'd appreciate it.
Good morning, everyone. Thanks for being here. I'm sure you're looking forward to the days when you can start your meetings without an update from San Juan Basin Public Health. But I am here once again to give a COVID-19 update for this week. Next slide, please. We continue to be organized in a couple of operational groups representing our major strategies to control the spread of COVID-19. That all starts with our usual strategies on the left that we do every day for communicable disease in our community, including disease surveillance through testing, disease investigation through contact tracing and case investigations, and then disease control through quarantine and isolation during the infectious period. Because of the spread of COVID-19, we are reliant on additional strategies on the right: mitigation through public health orders to reduce the spread broadly in the community, enforcement of those same orders, medical surge planning and fatality management in case it does get out of control. And then, of course, we are now in a vaccine administration strategy as well, which I'll talk about. We'll start with, I'm going to breeze really quickly through surveillance and testing. So Mike or Emily, whoever's controlling the slides, I'm going to put you through your paces this morning. We do have a data dashboard on our website, sjbpublichealth.org/coronavirus, where we update statistics every single day, including weekends. You can see this is how yesterday's statistics compared to a week ago. La Plata County in purple continue to add cases in La Plata County. And the summary for our surveillance data this week is that things are starting to tick up again. In terms of new cases per day, it is too early to tell, I think, whether that is a short-term spike associated with Christmas and New Year's or a longer-term rise associated with reopening additional types of activities, including indoors. You can see this La Plata County again in purple. We had case growth rates slowing off. That was really associated with moving La Plata County from level orange restrictions to level red restrictions. And then you can see just in the last couple of days, a tick back up to a steeper slope in that graph. This is the same information presented a slightly different way. You can see the volume of cases that we had to investigate in November and early December. We had a low period around the holidays and then started to come back up in the last week or so, although again, I think it is too early to determine whether that will continue. La Plata County on the bottom here, we do serve Archuleta County as well, as you've seen from these graphs. This is the same information adjusted for population. So many of you are now familiar with a 14-day cumulative incidence rate. This is the number of new cases in the last 14 days adjusted for a county's population. You can see a red line, severe risk. That's the threshold that a lot of you have been looking out for. Seems weird to be excited about moving from severe risk to high risk county. But that is what a lot of you and certainly what we were tracking very closely. You can see that La Plata County's incidence rate did dip below that 350 cases per 100,000 residents threshold for a couple of days, and then has come right back up into severe risk territory. The other metric that we track to make sure that this isn't just a product of different testing rates is our testing positivity. Again, La Plata County in purple. Positivity in La Plata County has come down from its peak and remains in the 5 to 10% range. We do want it to be below 5%, but below 10% is encouraging considering where some other counties are at. I do have some statistics for you from disease investigation and control. So what we've learned about our cases. This is actually going to be statewide data that was shared by the state epidemiologist last week that I think is really interesting. It's cases by occupation and how that compares to percentage of the workforce. So there are two slides on this, not just the one that you're seeing, but the first one you see overrepresented in our case data are people working in retail. This makes a lot of sense. These are people who have to work in person. They're exposed to a lot of different people over the course of the day, and they're usually working indoors. Meanwhile, you'll see underrepresented in the data are finance and insurance. These are generally people who can work from home. Next slide. The other industries that you'll see highlighted here, similar kind of story: professional and technical services and educational services underrepresented. Educational services underrepresented in part because so much schooling has been done remotely over the course of this pandemic, and also because there is lower evidence of transmission in a classroom setting than there is for a lot of our other indoor settings. There's a lot more control over that environment, of course. And then, of course, overrepresented healthcare and social assistance. We moved too quickly for me to remember what the last one was. I think it was retail food. Yeah, accommodation and food services. So this is hospitality and food service industry. Again, represented by working in person, usually working indoors and exposed to a lot of different people. So what we've been saying, we always get the question of, well, how do you know that these are the riskiest activities? You know, why don't we have as many outbreaks in these settings as these settings. What about this? What about that? I think this is really the best, most comprehensive data set that we have for the state of Colorado so far as to what industries are being exposed to the most virus. There are certainly a lot of complicating factors at play, but I do think the data tell a clear story that people who are working in person, people who are working indoors, and especially people who are going to be working around those who are not wearing masks is probably going to be the highest exposure risks. Other data that we have from the state epidemiologist this week is just some trends for exposure history. So in the 14 days prior to becoming ill is when we believe you may have acquired the virus. So these are just self-reported what people were doing during that 14-day period. You can see that the percentage of people reporting attending a social gathering has gone down from June to December. Lots of messaging around the risks of social gathering, especially indoors as the winter has come up. We think that's been effective, as well as, of course, level red restrictions prohibiting social gatherings outside the household. Contact with a known or suspected case, by contrast, has gone up. This is reflective, I think, of two things. One, that disease prevalence is simply just higher. There's a much higher likelihood that you right now know somebody who has COVID-19 as opposed to in the summer. And also around the state, more and more local public health agencies are now able to do 100% case investigation and 100% contact tracing, which is what San Juan Basin Public Health has been able to offer since March. Plenty of more data on this slide. The only thing else that I'll show is the fourth row, quarantining prior to symptom onset. This is also a measure of the effectiveness of contact tracing. So if this number is high, that means that a lot of people were already in quarantine when they developed symptoms. Which means that the contact tracing and quarantine system is fairly effective. You can see that this has really just fluctuated throughout the year. I think that's because our effectiveness of contact tracing has gone up, but at the same time, disease prevalence has been going up as well. Next slide, please. I'll now talk about our mitigation restrictions. Obviously, many of you are already familiar with this. La Plata County is in level orange high risk restrictions at the moment, has been since January 4th. Generally speaking, this is 25% capacity restrictions at most kind of establishments and events. The county is now producing a report card for each, or the state is now producing a report card for each county, which is intended to show eligibility for starting a 5-star certification program, which I think all of you are familiar with at this point. The report card is also useful for more generally, you can see on the left our incidence rate in La Plata County, again, dipped into orange territory before coming back up into red. Positivity dipped before coming back up. I do want to say on this report card, if some of you are seeing them, hospitalizations, there's been some press recently about hospitalizations going unreported for several months in a state reporting system, including from Mercy Regional Medical Center. We have no information about whether that data is reflected in these report cards yet. We believe that those data have been updated by Centura Health. That's what we've been told. But honestly, with hospitalizations, we essentially get a summary of the data. We don't have access to the underlying data in that reporting system. So I would use the hospitalizations report cards for La Plata County with a little bit of caution. Next slide, please. Now I want to talk about vaccine. Of course, everyone's really excited. The vaccines are rolling out. We've had a lot of success in the last couple of weeks, so I'll just sort of share our status and where we think we're going in the next couple of weeks. As a reminder, Colorado is using a phased distribution model for COVID vaccine, as is, I believe, every state in one form or another. The first phase is, of course, our highest risk individuals, those most likely to be exposed and have adverse health outcomes. Phase 2 steps that down a little bit, and then phase 3 is the remainder of the population. Phase 1 is split up into phase 1A, phase 1B above the dotted line, and phase 1B below the dotted line. Why they didn't just call those 1B and 1C is not something that's been shared with me, but that's a good way to think about it. These really are separate phases. All vaccine providers have been instructed to complete phase 1B above the dotted line before proceeding to phase 1B below the dotted line. It is likely that different counties and different regions will move across that dotted line at different times. That doesn't mean that we should immediately start vaccinating people below the dotted line when very small counties are already doing so. It means that we're going to proceed according to the state's phased distribution plan. As you can see, the estimate is that phase 1A will be substantially complete around January 15th. That's about right for Southwest Colorado. There will certainly be some 1A persons who still need a second dose after January 15th, but it will be substantially complete around the end of this week. We have already started phase 1B vaccinations, first doses. As a reminder, both of the vaccines that are approved in the United States right now are a 2-dose regimen. We are working on first doses for that upper half of 1B. Originally, phase 1B was just those first 2 bullet points: healthcare workers with less direct contact and our first responders. So that's who has really been working through 1B so far, working through vaccination clinics so far in 1B. Just a week or so ago, the remainder of the bullet points were added into phase 1B, and that represented an enormous expansion of phase 1. Phase 1 is now between 20 and 25% of all Coloradans. So a lot of work has had to go into making vaccine available for a lot more people a lot earlier than was expected while we were planning this out in December and early January. I'll show you a couple of ways that we've responded to that, but just know that our providers are starting to vaccinate with first doses people aged 70 and older. Again, this is going to happen a little bit at different times in different places as providers get enrolled, as they get deliveries of vaccine, and as they are able to make appointments. But we are anticipating that above the line is going to be what we work through for the remainder of January, as well as for most of February. And below the line will be essentially our work for February and March. Next slide, please. State has also put out a prioritization memo that local public health agencies should focus on remainders of phase 1, as well as our moderate risk healthcare workers and our first responders. Meanwhile, long-term care facilities will be vaccinated by the federal government's pharmacy partnership program. Here in La Plata County, we did get a head start on the federal program, which was not scheduled to begin until this week in La Plata County. So we were able to get a head start on that program. Vaccinate first doses at all of our long-term care facilities were complete last weekend. So we did not disenroll any facilities, in case that's a question for anybody who, works with one of those facilities or knows someone there. So anybody who was not able to be vaccinated during our head start or any new staff or residents will still be picked up by the federal program as they come through later this month. Meanwhile, all the other phase 1 providers, hospitals, health systems, pharmacies, and safety net clinics should focus on vaccinating people 70 years of age and older. There is some flexibility with this. So we have been working as a region here in Southwest Colorado, quite frankly, a lot better than many of the other regions have. So the percentage allocations or the breakdown in primary responsibilities is going to be a little more flexible in Southwest Colorado, because we already have really good habits around transferring vaccine around to make sure that it is used on time and used properly. That being said, many of you probably have questions about when you'll be eligible for vaccine, what of the groups on the state chart you fall into. We do not have any further information at San Juan Basin Public Health beyond the state chart itself. We are referring people to CDPHE via the phone number on your screen. We also can take your contact information and send you an email blast when appointments are available for the group that you self-report that you're a member of. Importantly, this link that you see on your screen is not a link to make an appointment. It is just a link to get a notification. And then you'll see on the right, we do have over 7,000 people already registered in La Plata and Archuleta counties through that notification, over a third of which are in our 70+ group. So we do encourage people. This is probably going to be one of your fastest ways to receive a notification, along with notifications from your primary care provider if you have one. But we do advise that it's a good idea to vaccinate, to get vaccinated when it is available to you, and to get notified when that will be. The biggest lift has been getting more approved phase 1 vaccine providers. As I mentioned, phase 1 was originally very small. Now it's very large. So we have 9 approved providers as of yesterday morning. Yesterday, we did find out that all 3 City Market locations, 2 in Durango and 1 in Pagosa Springs, have also been added as phase 1 vaccine providers. We believe there are others coming online in the coming days. So again, we believe, especially for the over 70 group, that is the largest group in 1B, this is very much going to be farmed out among a lot of different providers so that we can vaccinate as many people as possible on a particular day. But this is going to include healthcare systems, healthcare providers. It's going to include retail pharmacies. And then there will be opportunity, as I think Karen's going to talk about, for some volunteer-led community vaccination efforts as well. I have this slide in here as kind of a standard thing to show where we're at on a statewide basis. We learned yesterday that we have very low confidence in the exact numbers for people immunized with 1 dose, 2 doses, and cumulative doses. So I'll just point out that we remain in phase 1A and 1B. And then finally, next slide. You can see this is our status by region. Southwest Colorado, 62% utilization as of January 6th. That is the highest in the state. We're not terribly proud of 62%. We were at 74% last week. But what we did get in between those two reports is a whole lot of second doses that we were not yet able to use, because of course, second doses, you can't just use them as soon as you get them. They have to be given to people in the correct time frame after they receive their first dose. So that did bring our utilization percentage down. We remain the region with the highest success rate of vaccination. And I can report that none of our providers have had any vaccine go to waste. So we are getting the vaccine distributed on time and at correct temperature, correct handling, and they are getting it administered on time without any wastage. I think that's my last slide. We do keep our dashboard up to date, sjbpublichealth.org/coronavirus, as well as we refer people all the time to the CDPHE COVID page, as well as to the Centers for Disease Control and Prevention.
Thank you, Brian. We have 2 quick questions. Are we able to require employees to be vaccinated? And then also, can the employer host a vaccination event similar to what we did with testing?
I'm going to answer the second one first. The answer to the second one is not yet, but yes, eventually. So there's a couple different ways to complete a targeted vaccination event. The first would be to work with an enrolled provider, which could be local public health. It could be one of the many other enrolled providers, essentially due to a targeted vaccination event under their auspices and their medical license. So we imagine that will be a large component of the vaccination strategy, especially with larger employers. But we are not set up to do those kind of events starting today. When we get into 1B below the line and we're working with critical infrastructure, essential workers, usually the easiest way to do that is going to be to pair up an industry or even an employer with an enrolled provider. So to say, you know what, everybody who works in utilities is going to go to City Market North. And you make appointments through their link directly. That's usually going to be easier than setting up a standalone vaccination clinic. But as we get more and more people as enrolled providers and more people eligible to receive vaccine in phase 2, I do imagine that employer-sponsored clinics may be a part of the overall strategy. For the other question, are we able to require our employees to be vaccinated? I am not an attorney. I'm not comfortable answering that question with 100% surety. What I can tell you is that the state is not requiring anyone to be vaccinated. The federal government is not requiring anyone to be vaccinated. I believe that you will not be able to require your employees to be vaccinated, but I am not an attorney, and you should consult someone with more knowledge on the subject than I.
Great. Thanks for the update, Brian. Really appreciate it. We'll move on to Karen Zink. She'll talk about vaccination efforts as well.
Good morning, everyone. Thank you for allowing me to join your meeting today. I have some lofty goals for our community. I'm quite concerned about getting kids back to school and opening businesses and protecting our economy. So those are my primary goals. We are setting up a community COVID vaccination team. We're almost ready to go. This will be under the auspices of San Juan Basin Health Department. And we've needed to do some pretty comprehensive planning in order to get the go ahead, but that's almost in place. We plan to do a vaccine clinic on Saturday, the 16th for volunteers that will be held at the fairgrounds. And following that, we're hoping to have a vaccine clinic every week where we can do up to 1,000 people a day. So once we've given first doses of vaccine, we would be giving 400 or 500 of first doses and then sequencing in second doses. We're hoping that we can contribute to getting our community vaccinated quickly. And the model that we're using is our 9 health fair model that we've used for the last 40 years in La Plata County. And there is a team, 9 health fair volunteers who have formed the structure for this community-led COVID vaccination effort. So we will be helping San Juan Basin by taking names from that list and contacting people to come in for vaccines. And again, it's our goal to get a large number of people vaccinated in a short period of time if we can get that all pulled together. And I would be happy to take any questions.
Thanks, Karen. It doesn't look like we have any questions at the moment.
Great,
We'll
thank you
move
so
on
much.
Yeah, thank you. Thanks so much for everything, Karen. We'll move on to Laura Lewis Marchino, the Executive Director with Region 9 for an update.
Great, thank you so much. And I have some slides that I will be running through rather quickly. Many of you may have participated in the Southwest Economic Forum at Fort Lewis College last week. And I'm going to touch on the highlights of that presentation that is now available by video. I saw that Dr. Steve Elias sent it out yesterday. So if any of you are interested, please email me and I can get that to you. Also the slides for today. I know we don't have a lot of time to go into a lot of depth or have a lot of questions, but please know you can follow up with me afterwards. I'm happy to give you a lot of the nitty gritty. I'm a self-proclaimed data geek, so I love those questions. Next slide, please. And I will be moving pretty quick through these, so I apologize. What I wanted to do is provide some more specific La Plata data, but to set the stage, this is really Region 9, which is the 5 counties in Southwest Colorado, La Plata, Archuleta, San Juan, Dolores, and Montezuma. And this is employment by industry and wage. And obviously there are low and high wages in every industry, but this gives you a sense of what kind of the pay range is for our different industries. So in the region, government is our largest industry by far, and that's due to a lot of our public lands, primarily, not just your local government. Retail trade is second, closely tied with healthcare. And as you'll see, retail trade is a lower paying industry, and some of our highest paying industries have the least number of jobs, and you can kind of see that on this chart. Next slide. This is the percent of unemployment claims that were done this year through October. And as you can see, they're color-coded by county, and I will show you just La Plata's. But I wanted to give you this regional perspective because as much as we feel in La Plata that we have been dramatically impacted, and we have, especially in accommodations and food services and our retail trade, compared to our other surrounding counties, it is even worse. Next slide, please. So this shows just the unemployment filings by industry in La Plata County, and they're kind of ranked by number of claims. What this doesn't show is how many of those claims have now ended and those folks are now back at work and or they were not approved. Next slide. So this is just a snapshot of where they project industry growth over the next 2 to 3 years. And I say they, this is through MZ. We work a lot with the Colorado Demography Office. And because the job change numbers are so small, I again did this by region. You'll see that we'll expect the most increase in jobs in the healthcare and social assistance sector, and it's 330 jobs over the next 2 to 3 years. The highlighted areas in kind of orange show the areas that we expect the most growth. And for example, agriculture, forestry, fishing, hunting, that is primarily the increase in the timber industry that we're seeing primarily in Montezuma County. Next slide. Okay, this is La Plata County's economy. Think of this as the pie. Direct base are jobs that bring in outside money. So direct-based jobs are what we as economic developers focus on because they're bringing new money in and they're growing the economy, hopefully before we leak all our money out by shopping online or going elsewhere. So basically, new money comes in, that's 62% from tourism, visitors in the area, from agriculture, from manufacturing, things like that. And I will give you that breakdown. Compared to the region is 66% direct base. So La Plata County has less direct base than the rest of the region. Indirect base is 12%, and those are support jobs that are directly related to the direct base jobs. So for example, mining, utilities, the indirect jobs would go away if we didn't have mining or utilities. The part of the pie that I really want to focus on, because I think it's really indicative of kind of where we inherently know we're going in La Plata, and it's not necessarily good, is that this is local residential services, and that's over a quarter of our economy. And these are what I call the quality of life jobs. So these are the jobs that have the families, these are the core of our communities, our retail shops, our teachers, our firefighters, our law enforcement, and these are the jobs that are getting crunched by the affordability factor of housing and other things in our economy. And I'll talk a lot more about that. Next slide. So I tried to show you, this is the base industries, the 62% on the left, that's just La Plata, compared to the region. And I wanted to compare the region just to give you a sense that La Plata is not that different. You can see there's some small percentage changes, but basically these are these components of our direct base economy. I mentioned agriculture, I mentioned tourism, there's mining, manufacturing, and I'll explain what households and regional services are as well, and government, obviously. So this is the percent of jobs in each of our counties over those different industries I mentioned. And as you can see, all 5 counties, it's either tourism or households. And households is kind of a catch-all category. And then you'll see Dolores County has 30% in agribusiness. They're our most agricultural community. Next slide, please. So let me show you the breakdown of tourism. Again, on the right, I think it's your right, is the region, and then on the left is La Plata. So you'll see very similar regionally to La Plata. Basically, resorts is any destination type activity that gets put in resorts. So that's our ski resorts, that's Mesa Verde, that's the train, that's our rafting, things that can be predominantly tourism based that we know. Transportation, pretty self-explanatory. It's our airports, it's our car rentals. Second homes, very interesting, because our second home residents do not live here, quote unquote, or they're not residents, they fall in that tourism category, and they're a huge component of our industry. They bring in new money, obviously, but they also do affect our affordability. And then tourism services can be both residential and tourist services, things like restaurants, shops. And the Colorado Demography Office does survey restaurants to see what percentage of their business is local versus tourist. Moving on. So this is regional services, and it's pretty self-explanatory. It is not, they're businesses that do not necessarily work within one county. Obviously, education or colleges and healthcare. That's pretty, self-evident. Construction. The business services include things like engineering or architect firms. And then you have trade transportation, your UPS, your FedEx, all of those things. And again, La Plata is on the left at the smaller circle, but very, very similar to what we're seeing across the region. Next slide. This is households. Households, as I said, is a catch-all category, but please note that in that category that's bringing outside money predominantly is retirees, and they're bringing in their 401ks, the retirement benefits into our community. So that money is being spent in our community, but it's a huge piece of the pie. The transfer payments is social assistance. So your food stamps, some of your public programs, Medicaid, things like that. And we expect that that's going to grow in 2020. And then commuters, I want to talk about this. La Plata County is the only county that is actually losing part of their income from commuting. And the reason for this is we are a workforce center. You saw that with regional services. So a lot of people that come into work in La Plata County do not live in La Plata County, and they take that money back home. They pay taxes in another county. They have a house in another county. So that's why it shows as a negative in La Plata County compared to the rest of the region. Agribusiness, very self-explanatory. Production is, the growing of your crops, whatever. Processing, we have a larger processing capacity in La Plata because mainly we do have a meat processing plant. Trade would be the financing of crops, the transportation, warehousing, and then your inputs are your seed, your fertilizer. So again, comparing La Plata to the region. So this is all the income that comes into each of the counties. And I only have 2019 numbers, guys. Sorry, it's January. We're not that efficient. But what I want to note is at the bottom, you'll see it says the 60 plus share. So of our incomes in our counties, that much percent is from people over 60. So again, it's showing that we are transitioning into the top, the yellow, I'm sorry, it didn't come up with the headings, is transfer payments. So that's your retirement benefits, money that's coming in primarily to retirees or second homeowners. The blue is employment. The orange is commuters, there it is. And the dividends, interest, and rent is kind of self-explanatory. But what we've been seeing over the last 20 years is our employment numbers continue to drop. It is it's about 50% of our economy in each of our counties. And that's very concerning because that's jobs and that's businesses. So much of our income is not even related to employment. Just something to consider. And as you see, it shows a -1 at the bottom of La Plata. Again, that would be the commuters. I'm not quite sure why that one's -1, sorry. But in Dolores, for example, they have more people commuting out of Dolores for work and bringing that money back. So they're actually benefiting by sending their workers out, and that money comes back to their county. Next slide. Real quickly, I want to mention that Region 9 has been calculating livable wages since '99. And what we try to do is livable wages are not minimum wages. It's the amount of money that someone needs to make it in each of our counties. And that includes, food, clothing, shelter. It includes childcare, health insurance. There's a self-sufficiency budget that we use that comes from Denver and other areas that we kind of calculate that off of. And we localize it for local housing prices, rents, childcare, things like that. Basically, we compared the livable wage to the average annual wage in each of our counties, which is across all industries, all wages averaged. So what you see is basically, you make a little, livable wage is a little below average annual wage, but once you have a child, this community is no longer affordable, none of our counties, because you have to be making over $50,000 just to have a livable wage. And we all know if you're making minimum wage, you're not likely making $50,000. And then we show 2 adults and 2 children. And we also know there are many, many of our citizens that it's 1 adult, 3 children. So you're seeing that our affordability factor gets really impacted. And what we're seeing is if you don't make a livable wage, there's probably 4 things that happen. 1, you have more than 1 job. You're on public assistance, you are missing something really critical, such as transportation or healthcare, and you do, at some point leave the community. Next slide. I'm going to throw in housing. So this is what the median purchase price was in all of these counties for 2020. And that is based on some home sales. And I just want to point out that I looked at what home prices were in, I think it was La Plata County in 2018, and it was $387,500. So we went up $100,000 for a medium price home in 2 years. So basically what this shows you is, here's a price of a home, a medium price home, And this is the other column is the annual income that you need to have to even be eligible for a loan. And as you can see in Durango, you need to make over 100,000 a year to be eligible for a loan for a median price home. And then you can see the percentage of families with less than that qualifying income. So this, I think, really brings home kind of where our affordability issues are going. Let's see, next slide. So now I'm taking these housing prices that I showed you earlier, and I'm using it with one of the sectors I said is being dramatically impacted by affordability, and that's our teachers' salaries. This is taken from the state. It's an average of teacher salaries. Please know lots of teachers make more than this. Some teachers make less than this. It has actually gone down from the previous year, and we believe that is due to teacher retirements. You know, new teachers start in with less salary predominantly than longtime teachers. So here's your teachers. There's your median housing prices and the annual income needed for them to buy the home. So what we see is that no district in our region is a teacher making an average teacher salary able to buy a home on their own. Obviously, some have spouses, other incomes, but this is the affordability gap that we're starting to see and the quality of life issues as these people leave our community. So this is kind of what my message was with the Southwest Economic Forum, and this is just an overview of the slides, and that's all I have today just due to time. So I'll leave you with that tickler. Thank you.
Thanks, Laura. One quick question. The livable wage table that we had, are those wages pre-tax or post-tax?
Oh, that's an interesting question. I'm not sure off the top of my head. I would say that would probably be pre-tax. That would be your, you know, your actual income that you're receiving. But I can confirm that and get back with whoever wants to know.
Perfect. Appreciate it. We'll move on to Mary Shepard with the SBDC. Morning, Mary.
Morning, everyone. And obviously, can everyone hear me?
Yes.
Yeah. Okay. So I have not prepared slides because it would be so text heavy. I think it would be overwhelming. It is still going to be overwhelming. I'm going to run through kind of the highlights of what's coming out from some of these programs in the newest Economic Aid Act. We are doing a full webinar tomorrow morning. Right after this meeting, I have another 1-hour meeting with SBA. And then tomorrow, David Benavides will join us from SBA. Again, this is going to be just like last time. There's going to be a lot of gray areas that are going to get resolved as we move down the line. So there's some unknowns still. I will say that right now you can go to SBA. They have their interim final rules. They have the consolidated interim final rules, which is all the rules that came out over the last 9 months for kind of round one. And then they have a new interim final rules for second round. So let me just quickly go through these. Feel free to put questions in. I know I am notoriously bad at fast talking. It's going to be bad today too. So I apologize in advance. So quick things. One thing before we even get to PPP, SBA core programs. SBA, I don't know if you know this, but if you have a core SBA grant or loan product, they were paying your interest and premium for through September. They are going to bring that back. So if you have an SBA loan, you will get some more debt relief on that. That program is still open. So clients out there who are thinking about taking out a loan for growth or for other reasons besides economic recovery, now might be the time to do it. If you get a loan between February 1st of this year and September of this year, they will pay your first 6 months of interest and premium payment. So that's 6 months worth of loan that you're not paying up to $9,000 a month. And that's not a deferment, it's an actual payment. So keep that in mind. They're also going to be moving loan amounts, guarantee amounts up to 90%. Some of the maximum amount is going to go up on some of the loan products. So if you're thinking about an SBA loan, now is a good time to think about it. Go talk to your bank. Because there are some really interesting things that they're doing, incentives that they're doing to try and get some money into the economy, just kind of in regular loans. Okay, extension of SBA debt relief. Again, that's what we just talked about. Let's see if there's anything else in here I need to talk about. Oh, and the deferment for other disaster loans. So if you already had a disaster loan, and a lot of people in Southwest Colorado do, the deferment on those payments is going to be extended through March of 2021. Okay, EIDL has been extended through December 31st, 2021. So we have one more year of EIDL. If you've already had an EIDL for this disaster, you cannot get a new one. But if you already had an application in, or if you declined it, or you were declined, there is now the opportunity to go back for reconsideration. So that is still open. If you want to go back and you didn't take it the first time, you can take it now. And you may not need to start from scratch. So if you have an existing loan number, you might be able to use the reconsideration email. And I have that if anybody needs it. The big thing too now is that the EIDL advance will no longer be deducted from your PPP forgiveness. So if you have already gone through forgiveness, your bank should be truing that back up with you. So if you had already deducted that. So if you did receive an EIDL advance, they were deducting that from the forgivability of your PPP. They have reversed that. You should get that money back. So the new EIDL advances will be prioritized for low to moderate income. If you declined your advance because you thought it was going to reduce your PPP forgiveness, you can go back and look at that as well. Allegedly, Congress has said that they intended EIDL advances to be $10,000, not $1,000 per employee. So there may be an option for people who got less than $10,000, especially if they're low to moderate income or in low to moderate income communities, to go back and get the balance of that awarded to them. So we'll keep you posted on that. And they will have 21 days to issue those advances for new applicants when that program gets rolled out. Okay, extension of PPP. So PPP reopened. There's another $800 billion in there. Let me just go through these quickly. I told you about the two IFRs. So you've seen this in the news. The very first few days of PPP are going to really be for only through kind of small community banks, CFIs, CDFIs, so banks like First Southwest Bank, and also for the smaller businesses. So they're really going to prioritize trying to get money into people who maybe didn't get access to it the first time. And it's only for first draw. So if you have never had a PPP before, if you decided you returned your PPP for any reason you didn't get a PPP, or if after you got your PPP the rules changed and you could have gotten more, you can now go back to your bank and ask them to reevaluate your loan amount. So that is an option right now in round one as well. So that might be a consideration. That might be what you want to do instead of round two. If you've already applied for forgiveness and had gone through that process, you'll just go through and apply for a second round PPP. Let's see, we know it already opened. So yesterday was the first day that some of the banks were able to start working with clients and submit loan applications. Again, the CDFI banks. I think by the end of this week or the beginning of next week, we will see all the banks open and doing business with PPP. So if you already are working with a bank, it might be faster for you. If you already have the relationship, you've already got your numbers in with them, to just go ahead and work with a bank you already worked with. But if you're concerned about it, certainly go straight to a CDFI or CFI institution. Let's see, same kind of basic both for this draw, no fees or guarantee, no collateral, no personal guarantee, 1% interest rate. Payments will be deferred, I think, for 10 months. Applications for the second round are going to be different than the first round, so that might slow up the application process. Some of the banks may need to update their applications. Again, the deadline for this new PPP is going to be March 31st, 2021. Again, with PPP, there's a limited amount of funding. We'll see how fast the banks move through that. You can prepay without penalty. There is some expanded eligibility. So that's a big one in Southwest Colorado. Obviously, in the first round, it didn't include 501c6s. We are this time 501c6s are allowed to apply for this money. Also, some local news media organizations can apply, housing cooperatives, destination marketing. So there are some expanded eligibility so if you didn't get one in the first round because you weren't eligible, you should be applying for your first round PPP now. one PPP loan per EIN number. So we do know that if you are in NAICS code 72 and you have multi-locations, so if you are a restaurant and you have 3 locations, if each one has an EIN, each one can apply for PPP. There are maximum amounts per location and per organization that you'll have to look at. If you returned your entire PPP, you can reapply now under the current rules. So ineligible, if you weren't eligible in the first round, you're not going to be eligible now. So if you were not in business before February 15th of 2020, you're still not going to be eligible. If you are in, there are certain industries like marijuana that you cannot apply. If more than 15% of your activities include lobbying, and your revenues and the cost of your lobbying activities exceeded $1 million, then you're not going to be eligible. No publicly traded, no foreign acts, including affiliation with China and Hong Kong, no one who receives a grant under the Shuttered Venue Program, which we'll talk about. So you can't double dip there. And specific political figures, so Congress people, the president, they can't have access to this money. So 4 big differences between the first round and second round, or first round and second draw. There's more eligibility, but lower size standards. There is the revenue reduction. We'll talk about that. That's specific to second draw. Adjusted methodology of payroll costs. So I think it's page 27 of the interim final rules talks about the different ways that you can calculate payroll costs. And then they've got some new forms. So calculations, the maximum loan amount has changed. The maximum second draw loan will be $2 million per location or per business, or 2.5 times the average monthly payroll. You can use 19 or 20. 3.5 times in second round if your NAICS code starts with a 72. So if you're in hospitality and restaurants, you can get 3.5 times. Seasonal employers can calculate their maximum loan amount based on a 12-week period beginning February 15th of 19 through February 15th of 20. Farmers and ranchers in operation as of February 15th can use their gross income. So they'll have I think they're going to have a separate application for farm and ranch. Let's see. Oh, if you're in bankruptcy, you are not a, Francis say it, it's not a hell no, but it is a Hail Mary. There is a process if you're in bankruptcy to still apply for PPP, but it's a long process and it goes all the way up to the administrator. Sole proprietors, net earnings from self-employment capped at 100,000. We knew that. That's going to stay that 100,000. Agent fees. If previously you used an agent to apply for your PPP, you no longer allowed to pay for that with your PPP proceeds. So that payment will be on you. You can look at your first quarter 2020 financials versus your first quarter 2020 versus 2021. So you will be able to use first quarter 2021 if needed, I think, in that 25% reduction. Forgiveness, again, it's going to be a little bit easier. It's still the 40/60, but they've expanded what you can include in your operating expenses, that 40% for operating expenses, and they've expanded some of what you can include in your payroll. And, you know, I did have a conversation with ASAP Accounting and some of the CPAs over there, and they're telling their clients, don't rush your forgiveness application, especially with the expansion of allowing to apply for the employee retention credits in addition to PPP. So you may want to strategize on how you are using those two programs together. You can't double dip, but there are places where you might be able to get both. So if you think you might be one of those clients, you should talk to your CPA. Documents, you know, it's what the lender requires, but it's going to be mostly payroll documents to calculate your what your loan amount is. So first draw. If you didn't get a PPP in the first round, if you need to apply for to go back and re-look at the amount that you received, there is a $15 billion set aside for businesses with 10 or fewer employees. So they really are trying to keep money, you know, from running out the door on some of these bigger companies. In that pool of money, loan funds will be maximum of $250,000. You're going to use the application 2483 for first round. Use for payroll, interest on mortgage obligations. Not much has changed on how you can use it, except expanded definitions of what your operating expenses are. Borrowers who returned all or part of their PPP loan may reapply for the maximum amount. So if you were concerned you weren't going to be able to spend it and you returned any of it, you can now go back and as long as you haven't already applied for forgiveness. Okay, second round, you can only apply for the second draw if you've already received a PPP and you have or will have expended all of it before the second disbursement. You don't have to have applied for forgiveness on that yet, but you do have to be able to show that you've spent it all. You will use application 2483 SD for second draw. The criteria, I mean, you have to be eligible. You have to have been eligible based on the rules now, but you have to have had a first loan. In this case, when you're looking at a second PPP, you have to be able to show a 25% gross revenue decline in any quarter of 2020 over the same quarter in 2019. So that is important. Make sure you are going to be able to show that. They will not ask for you to prove that. If your loan was under 150,000 in the first round, they're not going to ask you to prove that up front, but you will have to prove that for forgiveness. So know that if you're over 150,000, you'll have to prove it up front. An important thing to note on that too is you're not going to look at your PPP proceeds. So whatever your PPP was in that quarter, that is not counted in your revenue. So it would be your revenue in that quarter minus the PPP that you received. Other grants that you received probably will count as part of your revenue in that quarter, but not your PPP or probably your EIDL, because obviously that's a loan. Or your EIDL advance, I don't think you'd count either, but I'm not 100% sure on that. In the second round, you have to be fewer than 300 employees. It used to be 500 in the first round. You can also use the alternative size standards for SBA. You can only have one second draw PPP, so you can't get a third PPP. If you're in NAICS 72, again, you can have multiple locations, and you're going to use a 3.5 times your average monthly payroll for your calculation. Maximum loan amount is $2 million. Maximum organization amount is $4 million. So any organization cannot have more than $4 million in all of their different outlets. Set
Mary?
aside for, yes.
Just due to time, I know you're going to cover all this in detail in the
Yep.
webinar tomorrow. Can you, is it at 9 o'clock tomorrow
It's at 9
morning?
o'clock. Yep.
Okay. We'll advertise that heavily today
Okay.
via blast email. If there's anything else that's like super urgent.
I mean, I think the other big one in all of this for people is that anything you paid for with PPP, you are now able to still deduct as expenses. That's another big one. There's going to be a shuttered venue program. So any of our local theaters or, outlets that do live entertainment that have been shuttered can apply for that, but they can't get a second round PPP. So you'll have to figure that out. Those are kind of the big ones. And they'll be, this is going to be ongoing as far as the guidance. So we'll probably, we have ours tomorrow. Jack is helping us with that. And then we'll do another deeper dive, I think, with Jack for his, which is going to be the last week of January. By then there'll be even more clarification.
Fantastic. Mary, if you could answer some questions,
Yep.
that would be great.
I will do that.
Thanks, Mary. I know it's a ton of information to try and get presented out there. Anytime
It is.
SBA and PPP is involved, it just gets complex.
And every single
move
business
on.
is going to have a different, availability to it. So come see us if you have any questions.
Absolutely. We'll move on to Jack Llewellyn, the Executive Director of the Chamber, and I think he and Dave Woodruff are going to talk about the 5-star certification status and then an update on that.
Yep. And you guys can hear me?
We
All
sure
right,
can.
good, thumbs up. So I hope everybody was taking notes with all the educators on the call coming up. There will be a quiz with all that information Mary just downloaded. So again, we'll have our session on the 28th from 9 to 10:30 since this is ever changing. Real quickly, I just want to thank all the folks over at La Plata County Sheriff's Office. When we launched the 5-star program, they immediately stepped up to help us with utilization of their officers as well as some of their staff to do the inspections. Also, the city of Durango and the Durango Police Department deployed 2 of their code enforcement personnel to assist with in-town inspections. The administrative committee is able to hire inspectors that will be trained by the Sheriff's Department trainer, and that is on an as-needed basis. For the 5-star certification program, we all know we cannot have any added work or burden to both personnel or financial impacts to San Juan Basin Public Health. so they can focus on vaccinations, contact tracing, and other ongoing requirements. So the administrative committee has secured funding, and we would like to thank the banks, including Bank of Colorado, Alpine Bank, Vector Bank, Bank of San Juan's, and First Southwest Bank, as well as the Business Improvement District and the Durango Chamber for funding this program. The financial support will allow us to go 4 to 6 months and even longer if needed. Program is led by Pam Glasgow, co-led by Emily Meisner. Through December 31st, approximately $2,300 was used to pay the contract labor expenses. And right now, about an estimated $800 was spent for supplies for the inspector packets. And just a reminder to everyone, continue using all the protocols, mask wearing. Again, we want to try and get those numbers of cases down below 350 so we can meet those metrics. And I just want to thank Emily with the Alliance, Tim Walsworth with the bid, and Dave Woodruff for their incredible work on the 5-star program, their hours they put in. I honestly don't even think they had a holiday season. So 3 of you, thank you so much for all your dedication. And with that, I'm going to swing it over to Dave. I got to jump to another call. And so Dave Woodruff, the man that never sleeps from the Colorado Restaurant Association Durango chapter, it's all yours.
Thanks, Jack. I'll go and give like a broader scope of what the 5-star program is. So you paid for the whole seat today, but you're only going to need the edge on this one. So hold on. The premise of the 5-star program is that a business, when taking extra precautions, can open up their facility to operate in a level above their current, the county's current level and the state's DIAL framework. The business commits to going above and beyond their community health program to be able to operate at a higher capacity level or less restrictive in how they can conduct business. The program has instituted an application system that goes to the 5-star program coordinator, which is Pam Glasgow, who sends it over to an administrative team who combs through each application to ensure it has all the relevant information in it and doesn't need any clarification. The application will then go to the lead inspector, Sergeant Adrian O'Haver of the Sheriff's Office, and his team to set up an inspection with the business. The business then will receive a formal inspection based upon CDPHE's guidelines for the 5-star program. And once a business has received a past inspection, the business can immediately open up for in-person commerce and can operate with those extra precautions in the level above their current, the county's current level and DIAL framework. The 5-star program in La Plata County was implemented on Christmas Eve, December 24th, and to date we have 56 businesses apply and receive their 5-star certification with another 2 in process. Initially, the 5-star policy committee, which is Mike, Emily, Tim, Jack, and myself, we rolled out the program with a focus on restaurants. And as we've gotten the program up and running, we're beginning to get gyms and fitness areas as well as indoor events into the fold to get them opened up within the 5-star framework. We hope to open up the 5-star program to those sectors as soon as this week. In addition to the policy committee, the 5-star program has an overall administrative committee that is comprised of many different agencies across La Plata County to dictate the direction of the program is going and to keep communication high between the program and the entities utilizing the program. Typically, a program that has to do with public health is overseen by the local public health agency, which in our case is San Juan Basin Public Health. But currently, our local public health agency's focus right now is on vaccine administration and contact tracing, and they're pulling all their resources, manpower, energy into those things. While they are part of our administrative committee to have and have the ultimate authority, the primary decision-making team is in the administrative committee. San Juan Basin is there to advise and help in the decision-making process for the 5-star program, but the AC does most of the heavy lifting. In addition to the AC or administrative committee, there's also a communications / community relations committee, a tactical committee, and an enforcement committee, each responsible for their own set of duties to ensure the AC can accomplish its work effectively. Currently, La Plata County is in level orange on the DIAL framework because of the governor's decision to move all red counties in Colorado to level orange. While that may be the case, 5-star restaurants as well as non-5-star restaurants are operating in level orange in both capacity and in operational guidelines. Once La Plata County's metrics meet level orange thresholds and maintain them for 7 days, those 5-star businesses can operate in level yellow, while the non-5-star businesses will have to remain operating in level orange. La Plata County is doing well on 2 of the 3 primary metrics that are used when San Juan Basin Public Health makes a decision to move between levels in the DIAL framework. Our ICU bed capacity is under 80%, currently 59%, and our percent positivity is under 15%, currently at 6.6%. But our new cases per 100,000 people over 14 days is a little high, as you saw from Brian's presentation earlier. The threshold is to meet and maintain is 350 new cases per 100,000 people over 14 days. As of yesterday, it was 462 over 14 days and trending upwards. When the 5-star program was instituted by the state, CDA-PHE made the clarification that would allow 5-star counties to move up on the operational framework after maintaining metrics for 7 days instead of the typical 14 for non-5-star counties. When a county is looking to move between levels on the dial, even 1 day over those thresholds starts to clock back over until we can get the numbers aligned to the level above. Our policy committee is confident the program will continue to benefit businesses that choose to implement the program during the pandemic. The 5-star program gives all but a guarantee that a business will be able to keep their doors open indefinitely, with the exception of being in level purple. Even in level red, a business can remain open so long as it upholds its commitment to keeping community health on the same level as business health. Through this 5-star program, we can strike the balance between those two endeavors to keep a holistic approach to community health. And I'm happy to answer any questions that you all may have.
Thanks a whole lot, Dave. Just for everybody on the call, I mean, getting this stood up between, largely the Alliance and the Chamber, I think Jack mentioned it, probably the most accurate. There really was not a holiday for those individuals trying to get this kind of stood up and open so people could eat in restaurants. So appreciate everybody's efforts. We'll move on to Tom Striticus, President of Fort Lewis College.
Yeah, thanks, Dave. I know many of our students are employed in your world, so we appreciate it and appreciate the community spirit here that we're seeing. Fort Lewis College, to our plan, we will begin on in-person instruction February 1st. Slight modifications, improving our plans essentially from spring. Every incoming student, both on and off campus, will be tested at our site beginning January 18th. So again, employers like Dave who have students who work with us, get them testing early and often so that you're able to do what you need to do. We'll test everyone before they come in, and then in-person classes will start then February 1st. We are using the Health Pass system and all the mitigation measures, masks everywhere on campus, both outside and inside. And again, our students really were excellent in terms of their compliance on that. So a few little wrinkles that we had to iron out, isolation teams, et cetera, but we feel like we've done that. And the faculty and staff have just been amazing in terms of their nimbleness. So we appreciate the effort that the community has rallied around businesses. We obviously need to do the same thing around education. So we need advocates. We need people really practicing those mitigation measures, because we know that will make a difference until we have wider distribution of the vaccine. So I'm happy to take any questions or pass it to my K-12 colleagues. The only thing I think I say is other great things continue to happen. Our region received the RISE grant, which was the largest of the governor's innovation funds, $3.7 million for career development, both in career tech and science fields. So, in addition to managing a pandemic and thinking through the threats to democracy, which are serious and a huge role for education, we continue to do our day jobs. So thanks for community support, and people know how to get in touch with me if you have questions.
Thanks, President Striticus. We'll move to Dr. Sam Damosu, the Executive Dean of Pueblo Community College.
Good morning, everybody. Happy New Year, and hope everybody's doing well, off to a great start. Just like Fort Lewis, PCC Southwest, we're going to be doing running virtual starting Monday. Students come back on Monday, the 18th, and we'll run virtual classes from now through February 15th. So for the first 4 weeks, we are doing virtual. For us down here in the Southwest, we have fewer gen ed classes, mostly career tech, your welding, automotive, law enforcement, nursing especially. So those students will be able to come in. However, we're splitting them, we're dividing them into smaller groups of no more than 6 in some instances, and we have a lot of space here. So that's making it that that's making it work for us. So, but again, I'll go, when we left last year, I think we switched to virtual 2 weeks before Thanksgiving. And then, we said we will go virtual this semester for the first 4 weeks, depending on what the condition is statewide and nationally, then we'll determine whether we switch back to face-to-face or continue that way. Let's see. Right now, I'm asking everybody to sign up for the vaccine. I listen to the San Juan Basin public health briefings every week, and they shared a link with us. And I shared that with my staff and faculty for them to sign up so that they can be on the registry and get vaccines. However, I have people who, my service area covers five counties. And so some of my staff are asking, what if I don't live in La Plata or Archuleta? And so we've been trying to connect with Montezuma County to do the same thing too. However, they're not ready. So it's a little bit disjointed in terms of how to get our staff and faculty vaccinated. But I think it's okay, and I'm asking this as a general question. I'm hoping it's okay that people can sign up in any county, or at least whichever one's available, because I think we all need the vaccine. At least encourage people to take it. So if that's not accurate, I'd like for somebody to correct me on that. But I'm telling my staff, sign up when I send the forms out to you, and then at least get yourself on the sign up list and get ready. So wherever you live, whether in Montezuma or in La Plata, wherever that's available. Enrollment is going strong. Excuse me. Right now, we're currently a little bit down from where we were last spring. We kind of measure ourselves year to year. So, but registration is going well. So we hope that those numbers will pick back up. It's just slow. It's just slow all around. However, we're doing the same thing that Fort Lewis is doing, encouraging people to just maintain those health precautions, social distancing, wash your hands, the good stuff. Everybody has to wear a mask on our site, and people come in just by appointment only. So we've been able to maintain that. So anything else? If you have any questions, please let me know. But things are going well for us as at the beginning, as a start of the new year. Thank you.
Thank you, Dr. Dusma. We'll move to Dan Snober, Superintendent of 9R.
Good morning, everyone. Thanks for the opportunity. First, I wanted to say thank you to our community for their patience with us. We certainly recognize that our closure has a huge impact on the community. Our staff is not immune to the fear and anxiety that many people are feeling with this pandemic. We're certainly seeing lots of teachers and support staff question whether this is a field for them, and that's a huge impact on our community if we lose the amazing people that we have in our district. So I do want you to just understand that we're working hard to meet their needs, as well as recognizing our job is to meet the needs of our children in our community. We do have PPE for our staff that will limit their exposure to quarantines. They are required to wear a KN95 mask and shields. Those are very challenging for our teachers because of the echo and the challenge of breathing with the KN95 mask while you're talking and teaching and being active with kids. We're continuing to work through that. We're excited to get our students back, but our commitment is to do so in a measured way that we can sustain. We will not turn back as we open levels in our schools. So elementary schools that opened yesterday, my commitment to you is, barring a major change in this pandemic, our schools will remain open from this point forward. Just to give you an update, elementary students did return yesterday, January 11th, and will be in school today as well. That was our original plan developed by our staff. I know there's frustration. We're not all week this week. Next week, we will begin our 4-day-a-week. Monday is a legal holiday, so it'll actually be 3, Tuesday, Thursday, Friday, and then starting the week of January 25th, we will serve elementary students Monday, Tuesday, Thursday, Friday. Wednesday has a great deal of benefit in contact tracing and limiting exposure risk. I'm happy to explain that further to individuals who want to reach out. Middle school students will start 4 days a week on February 1st, very much aligned with the college here in Durango. High school students will start on February 1st. Our goal is to start slowly and leverage all of our resources to make sure we keep that level open. If for some reason we struggle with elementary schools, we will pause with the next levels, but we will keep elementaries open. We will begin with a partial day. Remember, high schoolers are basically young adults who have the same risk of spread and contracting the virus. And so we do want to take extra precaution. Half day will be in person, half day will be remote. And then we will gradually increase that to a full day as we make sure we have the resources to do so. I am going to have to jump off here shortly, so I'm going to put my number and email in the chat box, and happy to take any questions via that. So thanks, everyone.
Super. Thank you, Superintendent Snowberger. We'll move on to Rocco, Superintendent Ignacio.
Good morning, everybody, and thank you for having me on this call. Just a quick report from Ignacio. We've been in school, open our building since August 23rd. It's been challenging, but at the same time, it's been very rewarding for the community because we kept our buildings open during this time. We did have the option of students being remote, so about 40% chose that. We do have a live remote teaching and learning every day, where students have to actually zoom in into their classes and be active learner during that time of the day when they have the classes. Yes, we have to quarantine. Right now, we have a whole freshman class quarantine because we have staff members we have more issue with staff being exposed to the COVID than students. So we're dealing with that situation, which creates another concern. We don't have enough subs to bring in. So we are juggling our schedule, but our buildings are staying open. We do have a test that we give, it's available to all our staff members. And we do that every other week, especially after the holiday week, Thanksgiving and Christmas. Last week we tested, and usually about 60 to 70% of our staff decides to have a volunteer test. We get the results within 48 hours, and that's going well. The other news, as you may or may not know, I'll be retiring in May 2021. So yesterday, the school district brought the 3 finalists, and they did interviews for all 3 finalists, and hopefully they'll have an announcement of the #1 choice Thursday night's board meeting. So that's I don't even know who it is, so I'm just waiting, and I'll be who's going to replace me. So at this time, that's one thing that we're working as a community. A few years back, we introduced a community-wide of character counts and the 6 pillars of characters. So we're using that as a model to begin a community of readers. It seems like here lately that kids are reading less and less, adults are reading less and less. So we're going to go community-wide and begin a program in collaboration with the public library, the Southern Youth Tribe, and all the other schools, private schools in our community. And we're going to start emphasizing reading from birth to the grave, I guess will be it. We're going to become the community of readers. So that's the news I have from Ignacio. Thank you very much. Have a great day.
Well, appreciate the update, Superintendent Frichetto. We'll move to Dr. Kevin Atten in Bayfield.
Good morning, everyone. Welcome for news from Bayfield. Many of you may have heard, last week that a week ago, the governor announced a testing program where they're actually going to send Binax test kits to our staff. They can be serial tested every 5 days, and they'll do that with a telemedicine visit. I think that's important, but as I'll speak to in a minute, I think that solves part of the equation. Obviously, our schools have been open since August. Yes, we've had some isolations and some things, but our schools have been open. We still temperature check every staff, every person, every day, and we feel like that's been successful, but also our opening of schools plan has really asked our community to keep kids home when they're sick and to be an active partner in what we're doing, and that's been also very successful. Thanks to our community efforts, our staff, our students, and again, our staff have been heroic and amazing. We have 90+% attendance in our schools. And that's, I think, a testament to how hard our staff has worked and how the confidence we've built up in how the community views what we do every day and how important it is. We also picked up 50 new students this semester, and new in air quotes is that we picked up students either that returned from our online education partner, or we've picked up brand new students moving into La Plata County and in Eastern La Plata County and Bayfield. So I think there is some movement, there is some things, the economy is still going, but as you heard earlier, San Juan Basin Public Health has done an amazing job with vaccinations. They've done an amazing job managing the pandemic. But I'm asking, everyone who will listen to me, that if you care about keeping schools open and we want schools open, then we have to do everything we can to get that above the dotted line vaccinated so we can get schools vaccinated. We can't just wait for some random month. And I feel really strongly about that. If the schools that are open, if we want our schools open, if we want our economy to take that next step, then our staff need to get to vaccination. And so if there's anything you can do, and you're amazing partners, I loved when we were in person and speaking with all of you. Please advocate with all of our people to get vaccinations going in our schools as quickly as possible, because that's going to allow us to be open and stay open. So obviously you can tell I feel passionately about it. One last thing, I think it's amazing. Dr. Striticus talked about the RISE grant in our region. Again, that's $3.7 million in our region. But listen to these partners. It's Pagosa, Bayfield, Ignacio, Durango, Silverton, Pueblo Community College, and Fort Lewis, all coming together in 2 areas of focus: building trades and environmental science. We know that building trades are a pathway to what Mrs. Marchino talked about, which is to a living wage. We know that building trades is that pathway to a living wage, but also we have a living laboratory all around us in environmental science. And all of the districts have strength in those areas. We're all working together. And so even in what I call the COVID era, we are still innovating and doing amazing things for Southwest Colorado, Region 9, and your Economic Alliance. Again, I'll put my number in the chat if you guys have questions or anything about the Bayfield School District. Awesome to talk to you about it. And remember, it's always a great day to be a Wolverine. Thank you.
Thank you, Superintendent. We appreciate everybody sticking on. We know we went overtime this morning, just a packed full agenda. Hopefully everyone found it beneficial. I know we had a lot of comments kind of sent back in with each panelist just highlighting, points of value. We appreciate everyone with the Alliance. I'll turn it over to Mike French if he has any closing comments. And we'll continue to try and help and support the community and our membership in any way we can. If there's anything else you think that we can be doing, please don't hesitate to reach out to myself, Mike, or Emily, and we'll chase it down. Mike?
Thank you, Jameson. Our next meeting is February 9th, and everybody can expect a slew of emails and announcements following up our meeting today in broad membership emails to specific things that we said we would follow up on. So thank you so much for your patience, and